So many of you probably heard the news about President Biden today and his prostate cancer diagnosis. It was shock and sad to hear. As a urologic oncologist, I deal with patients who have prostate cancer, and I was really amazed that it was a Gleason score 9 and that it had spread to the bones. There was metastasis. And I was just wondering, how could this happen to the ex-president? He is 82 years old. Usually we don't screen, but being the president, I assume he was getting all these tests done regularly. In President Biden's case, he was picked up with a digital exam because he was having urinary problems, something that's common as men get older, but they found a nodule. And I wonder, did he have a regular, because usually prostate cancer is picked up with PSA, but not always. And in fact, more aggressive disease like a Gleason score 9 can be picked up sometimes with the normal PSA, but a finding on a digital exam. So that's amazing, I think, that he got diagnosed. And it's tragic, though, that they found that it had spread to the bones because now there's no cure. We have methods of control. One control that they talked about is putting him on hormone therapy, which for Gleason score 9 actually may not work too long. That's a very aggressive cancer. It's a 9 out of 10. Nowadays, we'll combine, or at least we'll offer hormone therapy with another drug to give it an extra punch to try to keep the disease from progressing. But the more you add, the more side effects there are. And he already has elements of cognitive decline, although he doesn't have a diagnosis that's at least publicly been mentioned about dementia. But drugs like this could progress patients' dementia or cognitive decline. So that's something really important to consider. Also, I wonder if he might be able to take advantage of some of these newer treatments that are reserved right now for more later stage disease where the hormones aren't working anymore. Things, for example, drugs that are called in the class of radioligand therapy, where we actually have a smart bomb attached, which is a small dose of radiation attached to an antibody, which is attracted to these cancer cells. Imagine if it could attack the prostate cancer directly in the prostate as well as in the bone. We don't know if it's all over his bones or in just one area. All these things are going to be important in trying to figure out for President Biden and his doctors what's the best route of therapy. And so we wish him the best. It's just, to me, again, shocking and amazing at the same time that it was picked up and how aggressive the disease was.